At least it's really nice out. I know some of us are using this better weather to get out and start running, which has been awesome. I'm Dr. Sapna. For those of you who don't know me, I'm one of the co-founders at Integra Health Center. I've been moderating a lot of these webinars. So most of you probably know me by now because I know we have a attendees, so thank you so much. Today's webinar is going to be extremely beneficial for almost all of us right now. I think everyone can benefit from understanding more about this part of our back that no one really talks about, the thoracic spine, the mid-back, the T-spine, a lot of different ways of referring to this area, but the mid-back has been a culprit for, you know, a lot of different conditions, whether you're suffering from shoulder injuries, neck, back injuries, hip injuries. Honestly, there is involvement of the thoracic spine for almost all of these conditions, and I think there's benefit. And you know, it's something that most of us manual therapists incorporate when we are providing rehab. So I know personally Justin is extremely passionate about the T-spine. I know he lectures me all the time about my T-spine. So let's actually get Justin on video and mic here. Hi, Justin.
Hey guys.
How's it going?
How's the audio?
Yeah, no, I hear you okay. Thank you. So yeah, so I know you're super passionate about the thoracic spine. You're constantly always, you know, coming at the kitchen when we used to be in the kitchen together. Now we're not in the kitchen together, but I know you always used to say, Sapna, fix your back. And, you know, I used to get those nice, like shoulder massages, but you know, there's always so much technique though. I know all you guys are jealous, but you know, we're all in need of a massage, including all of us. We're all dying to get back into getting regular care. But yeah, so excited that you're going to be talking about this today. And you're joined with Dr. Stefan Kegel. Hello, hello. How are you?
Hi everybody. How are you? I'm excited to be here today, and I'm excited for Justin to give everybody and myself some tips. I'm looking forward to this.
I was waiting for you to join this because how many times have I or somebody stopped you too and been like, Dr. K?
Yeah, too many times. I don't want to admit how many times, but yeah.
It's all of us. It's all of us. And I think
sure.
right now, even more so, you know, even Justin and I, we're sitting in front of a computer a lot more often than we would normally. We're such hands-on people. So I think this is such a relevant and hot topic. And it's definitely something that I think for those of you who didn't even know it was a thing, I hope you guys all take away some really important and valuable information about our lecture today. A couple of just quick topics, or sorry, quick things to note before these two get right into it. There is a chat function at the bottom, so please definitely, you know, leave us some comments in there. If there's any questions that you have, there's also a Q&A. You can leave your questions in the Q&A box. We'll try to leave some time at the end to cover those. But yeah, if you want to just, you know, ask any questions, you have any other tips or things that you want to bring up, drop us a line. And aside from that, boys, take it away.
Hey Stefan, how's it going?
Good, thank you.
Not bad. Yeah,
wanted to say hi before we start this thing. Okay, so for those who don't know me, I'm Justin. I'm one of the physios at Integra, and today we're going to be talking about unlocking the thoracic spine and what that means. Right? Like, is the thoracic spine really locked up? Like, what does unlocking mean? Like, what is the thoracic spine exactly? So that's the kind of stuff that we'll be covering through this webinar. Okay, so the agenda, we're going to cover a bit of thoracic spine anatomy and function, common problems related to the thoracic spine, how the thoracic spine is tied really closely to the shoulder and shoulder pain, and we'll finish off with some exercises and remedies. So I'm going to try to, so half of it will be lecture style, and then the second half would be more of the exercises. Okay, so on to thoracic spine anatomy. So if you look at the picture on the right side, that blue portion of the spine is the thoracic spine. The upper portion, that yellow part, is the neck, the cervical spine, and the red portion is the lumbar spine, or the low back. So today we'll be focusing on the blue portion, or the thoracic spine. So it's made out of 12 thoracic vertebrae, and so if you look closely at the blue portion of the picture, you'll see multiple bones kind of stacked on top of each other. So each one of those bones are known as vertebrae. And in the thoracic spine, there's 12 little bones that make up that portion of the spine. And so the thoracic spine is the only area along the spine where the ribs actually. So again, if you look at the picture on the right side, you see all the ribs kind of stemming off of the thoracic spine portion and not off of the yellow or the red portions. And this is really important when it comes to breathing and rib expansion. So we'll talk about that stuff later on. So relative to the other segments directly above and below the thoracic spine, the T-spine is actually pretty mobile, or it should be mobile. But given the way that we're sitting, especially now that we're all quarantined and like working on our makeshift computers, hunched over like Smeagol from Lord of the Rings, that area will get locked up. And so this webinar is all about how to fix those issues. And finally, the last thing I want to talk about off of this slide is the shoulder blades actually sit on top of the ribs. And like I said, the ribs attached onto the thoracic spine, so everything there is kind of connected. And we'll kind of dive into it a little bit deeper as well. Okay, so muscles around the T-spine. I'm not going to talk too much about the details or like which muscles are around the T-spine. I mean, I think most of you guys know like the traps muscles right up top, the rhomboids in the mid-back. But the main job of these muscles around the thoracic spine is to hold up and support your back while you're standing up or sitting up. And it also helps stabilize the shoulder as you're moving the arms around. And so because of poor posture, because of muscle dysfunctions, muscle weaknesses, if the muscles aren't firing properly, you end up with symptoms or pain, stiffness, and issues, not just, like I said, because the shoulder blades attach onto the ribs, because the thoracic spine is attached to the lower back, attached to the neck. If you get issues in the thoracic spine, you also end up with issues in the neck, in the lower back, and everywhere else. Okay, thoracic spine and breathing. So if you look at that picture there, so inside the rib cage, you see those two pink things inside. So those are actually the lungs, and the lungs take up a lot of space in the rib cage. I mean, there's obviously the heart inside the lungs and other organs, but the lungs actually take up a lot of space. The lungs come all the way up to the collarbone, and they go all the way down to near the bottom of the rib cage. And so if you imagine, if you're sitting kind of slouched forward this way, and the ribs don't have the space to expand, the lungs will expanding, right? So if you have poor posture, it leads to actually more shallow breathing, and you're kind of breathing more through the neck as opposed to into the diaphragm to get that proper lung expansion. We'll talk more about the breathing afterwards as well, but the thoracic spine definitely is related to breathing as well. Okay, so thoracic spine movements. There's 4 main movements, not just in the thoracic spine, but through the spine, and that includes flexion, which is bending forwards. So kind of like that first picture there. Actually, that guy there has terrible thoracic spine mobility and probably tight hamstrings too, but that's a different story. So forward flexion, you're bending forwards. Extension, you're arching backwards. Side bend, this way. And then rotation, this way, right? But most of the time, I mean, with things that we're doing day to day, we don't often just move in one of those 4 movements. We're always moving in combination. So if you're tying your shoes, you're doing the forward flexion, maybe a bit of rotation, a bit of side bend. If you're reaching for something on the top shelf, you're doing thoracic extension, a little bit of rotation. And if any of these movements are restricted or locked up, you might. So common causes for thoracic spine pain. I'm going to cover mostly the more common causes, and the exercises today actually address more of these common causes, which include muscle pain from exertion. So if you're playing, a sport or lifting weights too heavy and you strain a muscle in the back. Muscle pain from overuse, so that includes posture. So if you're kind of trying to maintain good posture, but the muscles aren't strong enough to hold you up, the muscles end up being overused, and obviously stiffness and rounded back, which we call kyphosis, so that forward rounding of the spine. And I think this is where Dr. Kegel is going to jump in and talk about some of the red flags and injuries.
Yeah, so from a medical side, I mean, I rely heavily on our physio and chiropractic and massage colleagues to help with my patients with mid and lower back pains. I just wanted to go over a couple of things that we think about as medical professionals when we have somebody that presents with back pain. And the number one thing that I always like to rule out is the red flags, the things that I always ask about. So these red flags are indications when you should actually go to the emergency room because your back pain has flared up so much. So if at any point you're ever getting any type of neurological sort of numbness or tingling between the legs, we call this saddle paresthesia. If at any time that happens, that is definitely an indication where you would want to go to the emergency room. If you are ever having a change or a loss of control of your bowel or bladder function, that is also an indication to go to the emergency room. If your legs are ever so weak that you cannot walk, that's another indication to go to the emergency room. So anybody that ever sees me for a back pain consult or somebody that comes to me with back pain, I'm always going to ask those questions. And if any of those are positive, that's definitely a reason to go to the emergency room. So I just wanted to kind of lay that out there. Those are things that we always look for. Those are emergencies when it comes to back pain. A lot of people also ask me, should I be getting an image? And to be honest, imaging does very little for the management of back pain, unless we're dealing with chronic back pain, sort of over 6 weeks of pain, or some of these issues like with the red flags, then we wouldn't really need imaging all that much. And imaging is a little bit people that get an x-ray done and then they see the x-ray and they show that there's some mild sort of disc degeneration. And the fact is, if you actually like x-rayed everybody's back on this webinar, I'd say the majority of people would probably have these little findings on imaging, and images or findings on imaging doesn't necessarily correlate with symptoms. So it's important to remember red flags. It's also important to remember indications for imaging and the fact that imaging isn't really all that important when it comes to managing our back pain. And it's not really going to tell us all that much because imaging is a little bit non-specific. So when it comes to things like pain management, I think I really rely heavily on my colleagues, my physio and my allied health colleagues to help with that, because I think treating the underlying cause for back pain is ultimately going to help with pain management in the end. If it's an acute flare-up, there are different medications and classes of medications that we can use. I usually like to think of 3 types of medications. There's your anti-inflammatories, something like naproxen. There's your muscle relaxants, something like baclofen or Flexeril. And then there's your nerve medications. So if you were to come to me saying that you're having some tingling or numbness that's being referred to the front of your abdomen, or a bit of sciatica or like nerve pain shooting down the leg, then we might consider a nerve medication like Lyrica or gabapentin. So for the most part, I'd say 99% of the people that come to me with back pain, I end up referring them to physio or massage or chiro and my allied health colleagues, because that is really going to be the best way that you need to manage your back pain. And then in those very, very acute cases, or those red flags that I was mentioning at the beginning, then we refer to the emergency room, because that is an emergency. So all in all, I think the take-home points for me is, if you have any of these red flags, numbness or tingling between the legs, loss of control of bowel or bladder, weakness in the legs so much that you cannot walk, that is reason to go to the emerge. And try not to overvalue imaging, because imaging is really not going to change our management all that much when it comes to back pain.
Okay, thanks, Stefan. Yeah, and like you said, there's always a time and place for medications, for imaging, and these exercises that I'm going to go over in a minute will focus more so on the common muscular thoracic issues and thoracic stiffness issues, as opposed to the red flags and the more urgent cases that he just mentioned. So before I jump into the exercises, I want to talk more about the importance of thoracic extension. So I mentioned that the spine has those four main movements. So the flexion, extension, side bending, rotation. But the reason I want to focus a little bit more on the extension is because of the fact that we're always hunched forward, right? So if we're working away with our typical bad posture here, we're stuck in this forward flexion position, and we're not often extended backwards this way, unless we do yoga or gymnastics or something like that. We don't often go backwards this way, right? Because even if you think about our daily activities, like cooking, washing dishes, cooking, cleaning, watching TV, we're always either neutral or forwards. Like there's no reason to be backwards, and that's a problem because we spend 8+ hours a day forwards, so we need to balance it out going the other way. And so I mentioned that the shoulder blades kind of sit on top of the ribs, right? This is critical because if you want to lift your arms up over your shoulders, the shoulder blades have to slide on the ribs to actually get this full range of motion. And so if you have your back surrounded and the shoulder blades aren't able to kind of slide the way that they should, you end up with shoulder impingement issues, problems. So I'm just going to demonstrate here. If I have a proper alignment in my spine, I'm able to get my arms up overhead. But if I exaggerate and I slouch my back this way, there's no way I'm getting my arms up here, right? Because a lot of the movement comes from the arms, but a lot of it also comes from the thoracic spine, from the shoulder blade extension. And I mean, if you don't believe me, you can try it yourself and see how much range you guys have. And this is really important if you're lifting weights, if you're again, if you're reaching for things on the top shelf. If let's say you're doing a shoulder press and you want to get this straight up and down motion, but you're lacking that thoracic extension, and the arms can only come up to here. What happens is that if you don't have that thoracic extension, you have compensation movements coming from the neck and low back to try to make up for that lack of. And that's what happens. I mean, once your low back starts compensating, once your neck starts compensating, you end up with neck and low back issues. So if you look at this picture over here, so on quick glance, it looks pretty similar. The guy has his arms. The left one, his low back actually has that big arch over there. So he's just illustrating that even without proper thoracic extension, you can still get the arms up, but you compensate with the low back curvature. Okay, so onto the good stuff. I'm just gonna put the computer on the floor here. So the first one is thoracic segmental extension with the foam roller. If you don't have a foam roller, you can stuff 2 tennis balls or lacrosse balls into a sock. This here is 2 lacrosse balls taped up with hockey tape. Or if you don't have any tennis balls, you can just roll up a towel roll really, really tightly, tape it up, and you can use that as a makeshift foam roller. So at the gym, you see a lot of people kind of just rolling back and forth like this, which is good too. It kind of gets the blood flowing, gets the muscles warm. But for the thoracic extension, I want you to focus more on the extension portion of the movement. So you're going to start in your along the mid back. Don't start in the low back over here, because that can cause a bit of injury. Start in the mid back, hands supporting the neck. Then what you're going to do is arch back over the roller. Exhale. Come back up. Move up a little bit. So you're targeting different segments of the thoracic spine, so different vertebrae. Move up a little bit. Repeat. Breathe out. Relax into the roller. So if this hurts in a good way, so there's good pain and bad pain, right? Obviously, if you're getting sharpness, tingling, or any other bad pains, stop doing it. But if it's good stiffness pain, which a lot of you guys probably will have if you don't do this often, you'll probably experience a bit of that kind of stiffness. That's fine. So don't push hard into it. You're just gonna ease your way in. But it is normal to feel a bit of discomfort there because we're not used to this movement. One key thing I want to point out here before I move on to the next one is make sure that the movement is coming from the thoracic spine and not from the low back. Right. So make sure you engage the abs a little bit when you arch back, as opposed to just letting everything relax. So see how right now I'm arching back, but there's a lot of movement coming from my low back. You don't want that. You want the core engaged, the hips engaged, even the glutes, the butt off the floor, and you're extending through the thoracic spine, not the low back. Okay, so the next one, it's called the side lying windmill or open book. So ideally have a pillow or a foam roller under the top knee. Book is good for thoracic rotation. So you're gonna start here. Bring the arm across this way. Use the hand as it moves. And you're getting a nice thoracic rotation movement here. Keep this knee firm on the ground or the roller. Don't lift it off this way, because when you start lifting it off, you're missing that rotation stretch, right? And then try to get the hand down to the floor if you can. If you can't, again, that's fine. I can't. I'm pretty stiff. And the other one is the side lying windmill. So I don't know if you guys can see that. Similar motion, except instead of opening straight across this way, you're just gonna go make a circular movement and then finish like that. So as you're doing the movement, as you're opening the book, just to get an extra bit of rotational stretch in there. So that's the rotational stretch. The next one is called sniper breathing or diaphragmatic breathing. So again, I mentioned how the lungs sit inside the rib cage, and if your posture is bad, you don't often get the oxygen down to the bottom portion of the lungs, right? With diaphragmatic breathing, you're making sure that the oxygen not just goes through the upper portions, but deep into the lower lobes of the lungs. And with the sniper part of the exercise is the duration that you hold the breath for. So I just want to demonstrate what chest breathing looks like and what diaphragmatic breathing looks like. So the first one I'm going to do is just regular, bad posture, breathing through the chest. If you look at my shoulders, they'll elevate as I'm breathing. All right, so deep breath in, but the oxygen isn't really going down to the bottom. For the diaphragmatic breathing, if you look at this hand over here, as I breathe deep into my belly or into my the lower lobes of my lungs, you see this hand move forwards, right? So here I go. So you can see that the air doesn't just stay up in the upper portions; it goes down to the lower. And this is really important because when you're taking that deep breath and the lungs expand, it also means that the ribs and the T-spine get a bit of movement as well, which is always good. So for the sniper portion of it, what you're going to do is inhale for 4 seconds. 1, 2, 3, 4. At the very top of the breath, hold it for 4 seconds. 1, 2, 3, 4. Exhale for 4 seconds. 1, 2, 3, 4. And at the very bottom of the breath, hold it for 4 seconds. 1, 2, 3, 4. So that's 1 rep. And And I mean, if 4 seconds is too much, you can start with three or two, but don't just make it, you know, like a quick in and out, in and out. Make sure it's for at least 3 or 4 seconds. And again, breathing. If you're stressed, you know, high strung, like kids running around at home, do a few of these, and I guarantee that you'll feel better. Yeah, sad that you gotta do you gotta do more of these. Okay, so the last one is just a quick exercise that will help focus on the strengthening of the mid back. Right. Okay. So I mentioned that with bad posture, the muscles often get overused and tired trying to keep this posture. And if the muscles here don't have the proper strength to keep you up, but it's still trying really hard to maintain that posture, you end up with injuries, right? This one here is called IYT picture. The first picture, she has both arms over the head, so it kind of makes that I shape. The middle picture, she has her arms diagonal, like a Y, and the last one, it's out to the side like a T. If you have weights at home, stick with light weights, or even like a can of soup or something. Body weight is perfectly fine, especially if you're doing it off the ground. So I mean, you could do it off a chair like this. Just going to show you quickly with the chair variation. If you just hang off the edge of the chair here, and so you're fully relaxed on the seat. You can do the eyes this way. Hold for 5 seconds at your end range, and then and trust me, it looks easy, but if you do it, it's gonna burn the muscles out pretty quickly. All right, hold for 5 seconds, and this one, hold for 5 seconds. But without the chair, you can also do it just on the floor. See here, this is the eye here. So there's not much movement as the hands come off the ground. You really feel the muscles engaging. So the I, the Y, and the T. I'm sweating.
Justin, can I ask you a question?
Yeah.
So is there any use in doing repetitions of that? So if you were to do like little reps of these movements, or is it better to be static when you're doing the exercise? Just more from a personal question.
Yeah, I mean, I would say it's always better to do it for reps. So I mean, don't hold that posture for a minute, because oftentimes what happens is if you have that time goal, you know, if your ability is only 20 seconds, but your goal is to reach 1 minute, what happens is that you end up cheating, and again, you know, compensating in some other way. So it's better to do it for reps of, you know, let's say 5 or 10 seconds per rep times 6 reps, as opposed to, you know, doing like 1 rep with a maximum of 60 seconds, because you end up with proper form that way. That makes sense?
Yes, that clarifies it. Thank you.
I feel bad. I feel like I called Stefan out.
Hey, no, I'm just looking for things that I can do around the house as well. So, I mean, anything to unlock my T-spine, because I mean, everybody needs to do it, especially if we're all working from home. I think it's really.
And I think like we all kind of chimed in, like, I don't feel like enough of us prioritize this area of our spine, and it's just, it feels good. Like, I feel like I've already done enough of these, Justin. This is why I didn't join you today. I'm wearing workout clothes. I had every intention of joining you today, but then I just thought, nah, I've done my reps for today. But you know, you feel better. You actually do feel, you know, quite a lot of tension releasing, which I think is so important. I don't think enough people, you know, prioritize just the simple movements that can make such a big difference.
Yeah, for sure. And you know, you don't really need a heavy weights, right? So like I said, you know, keep it lightweight or even just body weight, and even doing those 2 or 3 reps face down, like I'm sweating. I don't know if you guys can see, but like I'm building up a sweat here. um, and that was just body weight exercise, right?
For sure.
Yeah, I think that's it.
Oh, is that the last exercise?
That's
Okay,
the last one, yeah.
Okay, so then we'll just kind of keep chatting. Yeah, so I think that's the thing. I think a lot of people, you know, are looking for equipment. A lot of people think they need the gym, and you know, what I've been kind of stressing, and we've all been kind of stressing over these webinars, is this is weird times right now. I think a lot of us are going on like Pop Sugar Fitness, Orange Theory, F45. We have no endorsements from any of these gyms. I'm just listing them off because they keep coming up in webinars. But I think a lot of us are looking constantly for like, how do I keep my fitness up? But you know, one of the things that I'm not seeing or hearing enough of is, how do I use this time to regain my foundation, right? Because I think a lot of people had a wake-up call with having to work from home, having to learn new ergonomic setups, how to figure out how to homeschool their children, and you know, work as a family around the dining table, you know, for 8 hours during the day, and then actually have dinner together after, without wanting to kill each other. And you know, jokes aside, like I think, you know, this is such an important time right now for us to look at how can we work on building back our foundationals, because you know, we don't really prioritize our posture in regular pre-COVID life. So right now, you know, when we do have a little bit more free time, or you know, where we can technically slip away from the office to do these exercises, I just think, you know, more of us need to definitely take this with us. So now, just to reiterate, Justin, if anyone is experiencing any sort of injuries, are these exercises something that you would first want to screen them to, like, you know, like review with them if it's safe to do? Is it something that they should just kind of get into? Like, what would you kind of advise? Because obviously, like there's as much as we can give generic advice and generic exercises, it's not a one size fits all kind of approach for everybody. So what would you recommend if someone is experiencing any injuries right now?
Yeah, I mean, I think if you're getting any kind of like acute pains, like Dr. Kegel was mentioning, any kind of numbness, tingling, that kind of stuff, these exercises might not be the first place to start. But again, you know, if you're experiencing that, like that very very common like stiffness, the nagging pain, in the traps, the nagging pain in the thoracic spine, or the rhomboids, like this area here between the shoulder blades, and it doesn't feel like an acute pain, but it's something that doesn't really go away, and everything feels tight and locked up. These 4 exercises will definitely help the cause. But again, you know, if you're unsure, or if there's anything acute going on, I would just say, you know, reach out to me or Sapna or anybody else here at Integra, and we'll get you sorted out.
Now, for those of you that are here, I mean, Justin, you know, like we said, he loves the T-spine. He is an extreme, you know, sort of like advocate for making sure our T-spines are moving. So for those of you who don't know, I think Justin, if the next slide might show it, but we do have, Justin does have complimentary virtual meet and greets. So like we said, not everyone has, you know, the same, oh, hang on, best time to, oh, wait, before I get into this, what's the best time to do these exercises? Before work, mid work, or after?
I would say, I mean, I think you just said all three of the best times: before work, during work, and after work, because all these exercises, I mean, they're all pretty like low grade exercises, right?
Right.
Like you're not doing like a one rep max bench press or anything like that. So right. I mean, ideally, like in the ideal world, do it before, do it during, do it after. I would say if you can only do it one time during the day, do it like right in the middle of your workday, just to break up those 8 hours or 10 hours of work.
For sure. For those that asked if this is going to be recorded, it is being recorded, and you are going to get a copy of these exercises as well as the entire presentation, so you can school your friends and family on anatomy too. So don't worry, we have that for you. And yeah, and I think for the other person who's asking about the use of a chair, that the Y's and T's cannot be done on a chair, there are a lot of variations talked about, Justin, you know, these exercises can be varied quite a bit, and depending on the level of fitness or the level of injury that you're experiencing, they would be modified. So that takes me to the next part that I was about to say. Justin does have virtual meet and greets. So basically a virtual meet and greet doesn't have to be video. It can even just be over the phone. Essentially, we've opened it up for those of you who have specific questions. Book an actual meet and greet with Justin, even if you just want to kind of clarify a couple of things that you had. For those of you who joined late on the webinar, same thing. Just jump on a call or jump on a video conference. You can leave your specificity when you book online if you prefer to just have it be a phone call or to have it be a virtual video conference kind of like this. So that way, you know, if there's any specific questions you have, then, you know, he'll. Some of the things that I think Justin and I have experienced too, just over virtual rehab sessions. So they're sort of like, you know, video teleconferencing sessions like this, but we hold you accountable. And I think that's the big thing. I think right now, you know, everyone's lost their personal trainer. Everyone's lost the ability to get a massage. Everyone's lost the ability to like really focus on their health. And I think what's really valuable right now is being able to make sure that these exercises are not only just being done, but they're being done properly, and you're being progressed in a way that you're actually going to come back, hopefully, you know, post all this stuff when we get our new normal back. You're going to come back with better foundations put in place. And, you know, and again, like if you have injuries and you're not sure what to do, don't just wait for things to reopen. There's a lot of valuable information. There's a lot of valuable care that can be provided. And if you are urgent, you know, definitely like ring up Dr. Kegel, figure out if you truly are an emergent issue. And if it is just really at the point where you're in debilitating pain, maybe an in-clinic urgent appointment is suitable for you. And that is something that, you know, between the medical doctors and between Justin, like they can figure that out. But for now, like we don't want you to put your health on pause. And we do have some upcoming webinars. So the next couple of webinars that we have, tomorrow, I believe, yes, tomorrow is going to be a fun one. We have New Balance. Yes, you heard right. New Balance is joining our chiropodist, Amanda Birch, along with one of our docs, Dr. Gravel, for a very awesome webinar on trying to figure out how to pick the right shoe. Everyone is confused about this. Nobody has a clue. They just kind of look for, you know, oh, like I heard this like brand, you know, shoe is amazing for me or for my friend, so I'm going to buy it too. But the reality is everyone's feet are different and every shoe is built differently. So if you're trying to figure out what kind of shoe to buy right now, 100% tune in tomorrow. And then for those of you, because you've been sitting so much, if you have a pain in your literal butt, something called sciatica, that's also going to be an excellent webinar to tune into. Amanda Lee, another physio with us, who's on this webinar right now, hi Amanda, is going to be providing you not only some amazing education about sciatica, because so many people, you know, are still kind of confused about whether they have a disc herniation, sciatica, a muscle strain. There's so many different types of, you know, things around sciatica. So she's going to school you on what that actually is, as well as giving you proper exercises, strategies, and tips to alleviate. And I just want to make sure I didn't miss any comments in the chat box. Okay, I think we have gotten most things covered. Again, Dr. K, thank you so much for being on this. I think it's super important that, you know, everyone kind of knows what the difference is between, you know, urgent, acute, medical emergencies, because you'd be surprised, a lot of us don't, because how many of the times, you know, do we walk around not knowing? And Justin, as always, thank you for walking us through these exercises, and all of our attendees, thank you again for all the continued ongoing support. And if you obviously have any other questions, you need an appointment, you just want to chat with one of our doctors or something COVID or non-COVID related, if you have any medical concerns, you know, ring us up. Dr. K may or may not be able to see you, but we have 12 other doctors too. So we've got a whole team ready to help you. And also Justin as well. He's like a Rolodex of exercises and things that you can do. So definitely here to help you. And until tomorrow, thank you everyone. And thank you guys. Thank you boys for joining in.
Thanks everybody. Thanks. Yeah. Have a great day.
Take care. Bye guys.
Okay. Bye.